I have the privilege of introducing a group of powerful, seasoned female politicians who have been and remain instrumental in the efforts that we've been making to control hospital prices. So first up is State Senator Liz Krueger. Senator Kreuger is chair of the Senate Finance Committee. She's had an amazing career in the Senate, and during that time, she has truly fought to make New York a more affordable place to live and work, so very in sync with the mission of the union and the health fund. Her introduction of the Fair Pricing Act, the site-neutral legislation that Eric just talked about earlier this year, was really further proof of that. Again, remember I told you that this is going to feature people who roll up their sleeves and act. This is an example of that. Senator Kreuger has been an invaluable partner in our efforts to protect working families, and we are so honored to have her in this fight with us. So please welcome Senator Liz Krueger.
Good morning, everyone. This is becoming an annual event for me, the 32BJ Gala, to encourage us all to get this done. So I'm Liz Krueger. I'm the finance chair of the New York State Senate, so I have to focus a lot on money. Even though I'm not that interested in money, it's just how you get things done or not get things done. And we all know, and first off, thank you 32BJ for doing this, for committing so many of your resources to help us get the facts, grow this coalition, and with any luck at all, finally get this one bill done this year. And I say just this one bill because the fact is we really need to be talking about how we're going to address the growing crisis being expanded upon by the federal government's cuts in funding for healthcare, to figure out what we do to make sure New York can provide the best healthcare for all 20 million of us, frankly, at less cost than we are spending now, because we're not going to have that money anymore. We're simply not. We're going to lose billions of dollars in healthcare through Medicaid, through basic coverage for people who may not have US citizenship, for funding for older people through the Medicare program as well, because they're also sliding in, without talking about it, reduced benefits for people on Medicare. In some states, they're already piloting mandatory Advantage plan instead of traditional Medicare. And I think many of you people in this room know what that means, even if you're perhaps representing workers in your union who probably are not Medicare eligible, although everybody has family who's Medicare. So we've got a crisis, and I believe never waste a crisis. And that is going to be more true for the New York State budget in the next few years than in any time in my life. And one of the ways we can help address the crisis for patients, for health insurance companies, for employers, whether they're union employers or private job employers, for actually the healthcare system, is to stop spending large amounts unjustifiably with certain hospital plans and in certain facilities. And we know we can do it. I actually met someone by accident at the coffee shop around the corner who works on cost efficiencies in hospitals. And he's from Detroit. His name is Shane. I don't know, he's somewhere out here in this audience, about how you can do it for less money. Well, we ought to be talking to everyone in this country who knows how we can do this with less money, because we need to. And you already just heard from several people. Wasn't Mark Cuba amazing? And the suggestions that he has that people can do. We need to address this. We can address this. You just heard from Menin and from, actually, who else spoke today? Assorted people, the statistics on how we're paying in some hospital settings in my own district 3 times the Medicare rates for the exact same services. We know that our public hospitals, who are under enormous pressure and do phenomenal work here in New York and other safety net hospitals around the state, that they actually can deliver services much more cost efficiently than many of our larger private hospitals. And they have, by definition, the sicker patient load, because it's people who didn't necessarily get the primary care their whole lives that they should have. So we know we can do this, and I believe that this one bill that I'm carrying with Chantel, who you'll be hearing from next, Assemblymember Jackson from the Bronx, you'll be hearing from next, that we have a bill that will help us get there. And it's not radical. It's not even not been done before. Even in New York State, we used to have a certain period of history where there were limits placed on certain provision of hospital care. That's what we're asking for. Put a maximum on certain kinds of hospital procedures or outpatient procedures, and not emergencies, and not if something else goes terribly wrong and you think you're going in for a stent, and it turns out once they take a look, they're going to do open heart surgery. I'm not proposing you're getting the same payment for stents as for open heart surgery. And our bill wouldn't do anything like that. So there's a lot of misinformation about how much you could bill for and under what circumstances. You already heard quite a bit about facilities charges being applied. You know that there are millions of New Yorkers who are on the verge of seeing their insurance rates go up because they're going to lose their tax deductibility. And you know that there are millions of New Yorkers who are on the verge of potentially losing their insurance altogether because of changes in the federal laws. And so just asking for a Fair Pricing Act that is estimated could save $213 million in lower out-of-pocket expenses for these patients is nothing to just blow off and go, that's not a priority for us. It has to be a priority for us. And you know that you're hearing the numbers on what government could save as well, because of course government is the employer between city and state of hundreds of thousands of New Yorkers, where we get hit with those insurance costs as well. And we also know that the costs that are growing make it a fundamental reality that people are having to make the decisions of whether they get the health care they need or whether they decide they economically can't. Because even if they have insurance in certain kinds of plans, they have to pay so much out of pocket that they still have to make the decision, am I paying the rent this month or am I getting the health care I need? And so I'm here to say we can do it. This bill has been thought out carefully. I hope that everyone will take a look at the bill if they haven't already, and ask the hard questions. Ask me hard questions. Ask Chantel Jackson hard questions. Ask our hosts here at 32BJ hard questions, because they put together a pretty impressive team of health policy and health care financing experts. And by the way, I get healthcare financing is like the brain surgery of government budgeting. It's very overwhelming. Hospital financing is very overwhelming. But these aren't unknowns. These are known facts. We have academics who have worked with us, and I just want your help to get it over the finish line this year. Thank you so much. Okay, thank you so much, Claire. You're such a great partner. Thank you.
Thank you so much, Senator Jackson. Kreuger, excuse me. Because the next one, instead, we're next introducing a State Assembly member, Chantel Jackson. Chantel Jackson has also been a partner with us on the Fair Pricing Act, and her support for this, we heard Liz, she comes from that finance perspective. Assemblymember Jackson comes from a strong grounding in the importance of equity and fairness and empowerment. So this was a really logical fit for her. Chantel Jackson started her career prior to becoming an elected official as a social worker, and she continues to bring that ethos into the work that she does to try to champion people at the community level and bring that perspective up to the state level. That perspective has been really indispensable for us because it is so much in sync with our members' needs and our members' perspectives. So we are deeply grateful, Assemblymember Jackson, for your support and your ongoing partnership. So please welcome Assemblymember Chantel Jackson. Thank you so much.
Thank you. Good morning, everyone. How's Mark Cuban, seriously? How was it? So yes, I'm Assemblymember Chantel Jackson, and I have the privilege and honor to work alongside Senator Liz Krueger and 32BJ on this really important piece of legislation. As mentioned, I am a licensed social worker, and shout out to the social workers. And so I'll just share how and why this bill is so important to me in my district. But before I say that, I will say that I just came back from a Legislative Women's Caucus retreat. So we have 73 women in the state legislature, and I happen to have the privilege of chairing that caucus. And we were talking about things like mammograms, things like flu shots, things like all things that impact women and families. And so with Fair Pricing Act, how it relates is that we shouldn't be paying for the same service in the doctor's office, the same exact service, nothing extra. You're not giving me any new deals. We shouldn't be paying something exorbitant in one office versus another if the care is the same, right? And so while some people may be able to afford to pay this copay, in my district, the 79th district in the South Bronx, we are the highest in obesity, diabetes, heart disease, asthma, you name it, we have it. We are living in poverty, right? And so these people, when you tell them that, okay, you have to go to get your regular checkups, and one year they can afford it. The next year they can't afford it, you can believe that the next year they won't be back. And so for me, Fair Pricing Act is important to save lives, especially in my district when, like Liz mentioned, they're choosing between rent and health care. And if a family has to choose between food and health care, every single time it's going to be food because they want to make sure that their families are okay. So for me, Fair Pricing Act is not just a bill that I'm urging my colleagues to assist me with getting across the finish line. It's not just a bill. This is about people's lives, right? We have a government shutdown happening as we sit here and have this conversation. And some people are here fighting for healthcare to make sure that we all can be taken care of. Just last night, I was in Mount Sinai. I spent the last 4 hours in Mount Sinai with a friend who passed away. And so when I tell you these things are real, they are. And so I just want to make sure that we are humanizing this Fair Pricing Act bill. It's not just a bill, this is lives that we're talking about. We want to make sure that it's affordable for not just people, not just one group of people, but for all groups of people. And so that's why I thought it was extremely important that I be a part of the sponsoring of this bill, but also having the hard conversations with our colleagues, with the governor's office, with my leadership, and with Liz Krueger's leadership. It's really important. So the politics will keep us out of certain places and keep bills from passing. So we have to do both things that we know is right, but also play the game to make sure we get it across the finish line. And we made sure that our safety nets hospitals were not impacted, because that's the first thing that people are going to ask me about, right? Like, they're already having financial issues. How do we make sure that the safety nets are okay? And so we know that we can't, sometimes we have to come back to the table and we have to give and take. And we made sure that our safety net hospitals were okay with this bill as well. So as Liz had mentioned, if there's any questions, comments, suggestions, we'll be here listening. That is our job, to listen, to come to a place where everyone is okay with the bill and we can get it across the finish line. Again, I'm your Assemblymember Chantel Jackson. I say thank you for being here. Let's continue the work.
Oops. Thank you so much for all your support. So these two women are going to be critical partners in our effort to get the Fair Pricing Act passed this year. We're really excited today to announce, so when we started this, one of the principles of the work that 32BJ Health Fund does in this effort is to make all of our material available and out there, because the belief is that a rising tide raises all boats. I'm sure I just got that completely wrong, and my staff is laughing at me in the back of the room. But either way, it's good to do things that are good for everybody, right? Because it has an important ripple effect. And so when we drafted the site-neutral legislation with the support of amazing people in Albany, one of our goals was that it could be made available and serve as a template for other states, because there's so much inertia at the federal government that the states become super important. So we're really excited to announce that today, the National Association of State Health Policymakers is launching their model legislation, site-neutral legislation, that can be used by any state in the country. And it's modeled after the work that we are doing in New York. So it's really important we pass this bill. So we have, it's available now, there's a QR code, and this is an example of the kind of ripple effect of when you start with something, you don't always know how it'll play out, but this we're hoping to see take off around the country. So that is super exciting for us. So encourage you to, for those of you, how many of you are from outside of New York? Oh, we've got a great contingent. So we really encourage you to take a look at this legislation and see if it's perhaps applicable, and if there's a place for it in your state. So next, I have the privilege, the really deep privilege of introducing New York City Council member Julie Menin. Our very first conference opened with Julie announcing her legislation to create an Office of Healthcare Accountability. Her fierce support, and that may be an understatement, led to its unanimous package. But what's really amazing is that the fact that just 3 years ago, we made that announcement, and now later today, you're going to hear from that office with its first report. That is like lightning speed for public policy work, and I would say that's thanks in no small part to her tenacity. She has been a champion in City Hall for reining in hospital prices and protecting working families. And Julie, come on up, because we could not have done this without you.
Thank you so much, Claire, for that very kind introduction, and it's so great to be back here at 32BJ, who I've been honored to partner with on driving down skyrocketing healthcare prices. So again, my name is Councilmember Julie Menin. I represent the east side of Manhattan as well as Roosevelt Island in the New York City Council. I first of all want to acknowledge my colleagues in government who you already heard from. State Senator Liz Krueger also represents the east side, and Assemblymember Chantel Jackson. So many of you know that the topic of hospital prices is very near and dear to my heart. I started my career as a regulatory attorney specializing in the healthcare field, and so it's wonderful now to be back working on these issues once again. I was honored, as I mentioned, to partner both with 32BJ and DC 37 over 2 years ago to pass legislation that created the nation's first Office of Healthcare Accountability. When I introduced the legislation in 2023, it was clear that New York desperately needed to shine a light on hidden and oftentimes confusing healthcare prices. So for example, I know many of us, as we started delving into the research, were shocked to find out, for example, if you're a woman and you're giving birth by C-section in New York City, if you go to one New York City hospital, you might be paying $55,000 for that C-section. And yet at another New York City hospital, that same C-section is $12,000. As I mentioned, I'm a regulatory attorney, specifically a consumer protection attorney, and I cannot honestly think of another field where you as a consumer are procuring a service albeit at your most vulnerable time when you're going to the hospital, and yet you have absolutely no idea what you're going to be charged for that very service. And that is why we made sure to pass this law at the City Council. It was honestly a tough fight, I'm not going to lie, but we had a bipartisan supermajority of support in the City Council in support of this common sense measure, and it thankfully passed. That office made New York City the first in the entire country to have a municipal office to monitor hospital prices and to use the city's purchasing power, basically to harness the purchasing power to drive down hospital costs. 32BJ issued a seminal study a number of years ago that showed that New York City could save up to $2 billion a year by harnessing our purchasing power to drive down hospital costs. Our city is unfortunately facing severe fiscal threats. We're also facing threats from Washington in terms of cuts to our city budget, and that is what makes it more important than ever that we harness our purchasing power. We as a city have a $116 billion city budget, and almost 10%, or roughly $11 billion, is spent on public sector retiree and dependent health care. And just sort of by way of comparison, that same number in the year 2000 was 1.6 billion, and in 2017 it was 6.3 billion. So you see how it is astronomically rising year after year, and so it's simply unsustainable, and that's why we as a city must address that. We fought tirelessly to get the office fully staffed. Thankfully, it was properly and fully staffed last year. Then we had a situation where Anthem would not release the necessary data for the office's first report. We fought back on that, and we got Anthem to agree to release that data. And I'm so excited because later today, you're going to be hearing directly from the Office of Healthcare Accountability on the findings of their inaugural report that was released earlier this year. And I just want to highlight a few of those findings. It's abundantly clear that New York City has some of the highest hospital prices in the nation, yet those high prices are not necessarily giving us a higher level of quality care or better health outcomes. The average annual premiums for family coverage in New York State are the second most expensive in the country, only behind New Jersey. And so the reality is that far too many New Yorkers are avoiding going to the doctor in the first place because they fear the bill that they will receive after. And I know we all agree that when our neighbors and family members get sick, they should be able to focus, quite frankly, on getting better, not worry about how much a bill is going to cost. But the reality is it's nearly impossible to walk into a hospital and know what type of bill you're going to be receiving on the other end. And if you think about it, I mean, you wouldn't expect New Yorkers to shop at a grocery store without the prices listed, or to sign a lease without knowing what your monthly rent is. And going to the doctor should frankly be no different than that. So I'm so proud that the city, through our legislation, has created the first step in hospital pricing, transparency, and accountability. So now the city has to harness its purchasing power to drive down these costs so our city health plan does not continue to eat up such a large percent, 10% of our New York City budget. The office's latest report shows that there are excellent hospitals where patients can trust that they will get the high quality care they deserve. But yet, unfortunately, according to OHA's inaugural report, which you'll hear more about, we see prices vary significantly across systems. So for example, and I gave the example of the C-section, but another example is routine colonoscopy. We all need colonoscopies at some point in our life. And you may be charged, if you're having one in New York City, anywhere from $2,000 on the low end to $9,000 on the high end for a colonoscopy. In addition, the report shows that the city's medical spend for its comprehensive benefits plan was last year $5.7 billion, and more than half of that spend went to hospital facilities at a total cost of $3.3 billion. And of that $3.3 billion, there were 3 systems, Northwell, New York Presbyterian, and NYU Langone, that received over half of the city's hospital facility spend. So I know the OHA, a talk that you'll be hearing from soon, will delve more into that. But in addition, using Medicare as a benchmark, the city's prices are similar to many commercial purchasers in New York State, with most hospital prices landing between 2 and 3% of what Medicare pays. So large hospital systems that have market power have the highest prices, and their prices are increasing at the fastest level. In certain areas, we're seeing particularly concerning prices and price increases year over year. So hospital outpatient prices rose from 250% of Medicare to 280% of Medicare. And outpatient emergency department prices were a standout, averaging a whopping total of nearly 600% of Medicare. Yes, that's right, 600% of Medicare. So when looking into the averages, however, we're seeing that it hides some of the more shocking price outliers. So 392% of Medicare, that is the amount that the city paid for hospital outpatient services at one New York City hospital for services like a colonoscopy, or 318% of Medicare, the amount the city paid for hospital inpatient services at another hospital. So these are just many of the numerous examples that you'll hear more about that the report really lays bare. So we hope fervently that by creating this new office, that we will be working with hospitals to once and for all lower skyrocketing healthcare prices, really for all New Yorkers. So I really want to thank 32BJ for inviting me to speak tonight, for their incredible leadership, their incredible partnership in working with us on this legislation and on this seminal new office. Thank you so much.